I had a moment, an interaction with a total stranger on the street this morning while I was walking the dog that I found actually so heartbreaking that I said I was going to do a video about this, not realizing at the time that today actually marks the 1-year anniversary of our government declaring the situation a pandemic. 1 year it has been since our government told us 2 weeks lockdown to flatten the curve so as not to overwhelm the healthcare facilities. And we all complied. We all complied with what we were initially told was the ask. The 2 weeks turned into months. It turned into face masks. It turned into mandatory face masks. It turned into social distancing. It turned into mandatory social distancing. It turned in Quebec at the very least, into a moral contract to avoid contact with other people. A moral contract, basically, for humans to not be human. For humans to not engage in that which is fundamentally human behavior, social human behavior. Then it became mandatory, as do all government asks. It became the government telling us how many people we could gather with outside, how many people we can have into our house, that we can't have people into our house, that we can't celebrate the holidays with our loved ones. Then it turned into, in Quebec, a 4-week curfew, which turned into an 8-week curfew, which has been extended to an 11-week curfew. Just like that, subtle, discreet, just keeps ever expanding. And now the government today is commemorating those who died of COVID, and in fact, basically commemorating the victims of their own incompetence, their own failed policies from the beginning. And this is not the purpose of the rant of this video, but few people know this. In February 2020, the Trudeau government donated Canadian PPE to China to help China deal with the outbreak in China, knowing full well that an outbreak in China was going to be coming to Canada. Donated our PPE to China, which meant that when this outbreak occurred in March in Canada, we were lacking PPE, and more specifically, long-term healthcare facilities, where between 70 and 80% of all the fatalities occurred were lacking PPE to deal with this. And I know this. I received calls from people who had loved ones in long-term healthcare facilities saying they don't even have the means to deal with this. Why? Well, government-run institutions tend not to be run all that well sometimes, especially when they don't have PPE because the Canadian government just donated it to China. And this is where the spreads occurred in the beginning. In fact, this is where up to 80% of the fatalities occurred. And why? Well, because when the government also locked down everybody in March 2020, what ended up happening is that there were no employees, inadequate numbers of employees to work these long-term healthcare facilities. So they were recycling employees from one facility to another facility. And they were carrying the virus from one facility to another facility where this virus spread, because that is where it spreads among the most vulnerable. And so now our government, which has turned its response into an industry, is commemorating those who died, at the very least, in part because of their own failed and flawed policies. And all the while, the non-vulnerable, those who would be virtually certain to survive infection, have had their lives and their livelihoods crushed and utterly destroyed over the last year. Just shut down businesses, lockdown, curfews, what would otherwise be tyrannical regime MOs have now become accepted methods of governance, and people have had their lives and their livelihoods destroyed. They've been in isolation for a year, going on a year. And so this all circles back to the experience I had with this woman on the street. And it's not the first of them. I mean, I talk with everybody. People want to talk. People need this interaction. And I'm walking Winston on the street, and he's got white fur, and he gathers the snow on his feet. And the dog also just wants to see people. He sees people, he wants to pet them, but he's dirty, and I don't necessarily like letting him jump on people and get them dirty, so I hold him back. And this woman, an elderly woman, I would say maybe 55 to 70, stands in the middle of the street, and she's looking at him, and she's not really smiling, so I don't know if she wants me to come closer. And I ask her, can I let him come closer? And she says in French, she says, laisse lui vivre, let him live, the dog. And so I say, he's going to get you dirty. She's like, I don't care, let the dog live. And the dog jumps up on her, puts his paws on her, and she leans over and pats the dog, and she's stroking him, and she's looking at him. And then after we're done talking, she stops and she says, ça m'a donné tellement de joie, un joie que j'ai pas subi depuis longtemps. She said, this dog just gave me so much joy that I haven't experienced in a long time, because people are living in absolute isolation. I saw the ads on the radio, talking about mental issues that people might be going through now, followed up by an ad from the government saying you can gamble online now in Quebec. And people have been living in isolation. People have been not going for elective surgeries. And people tend to think, elective surgeries, or I want to have a mole removed, or I want to have a ganglion cyst in my wrist removed. No, elective surgeries are far more important than that. And the consequences of this, we won't be able to measure it in numbers today, but we will be able to measure it in numbers over time. And so what seems like a victory today because one life saved comes at a cost. And anybody who pretends that policy decisions don't come at a cost, and that it's just as easy as saying, lock everything down now to prevent deaths now, it's not that simple. Anyone pretending it's that simple is trying to sell you something, probably a 2-week lockdown. And this woman, Lord knows when she actually talked to somebody else. And people have been tormented over the last year into being terrified of other human interaction, to the point where people literally jump onto the street to avoid crisscrossing you on the sidewalk. And it's not an accident. And it's not necessarily because of the virus itself. It is because of what the government has been pushing on us psychologically for a year while all this happens. As though there are going to be no second-hand consequences from the policy implemented. And psychological, educational, business, this stress comes at a cost. But going right down to not going to a dentist comes at a cost. Bacteria in your teeth causes heart condition. People, but that we'll see that in years. And as of now, when the vast majority of the cases and fatalities in Canada originated in or occurred in long-term healthcare facilities, and largely because of bad policy to begin with, it is society as a whole that has to be leveled by a sledgehammer response from the government. There's the old expression, don't take a sledgehammer to kill a fly. Or you don't kill a fly, you can't kill a fly with a sledgehammer. Whatever. It's like killing a fly with a sledgehammer is the expression. You know what the irony is? You can't kill a fly with a sledgehammer. All you can do is destroy everything around it. A sledgehammer will destroy everything around it, but you can't actually kill a fly with a sledgehammer. That's the irony. The government has taken a sledgehammer to everything that we once knew as a society, from the economy to our physical health to our psychological health. And now they sit there laying wreaths and commemorating the results of their own failed policies. I don't know where I was going with this. Setting aside the civil rights side of this, what a future holds when a government thinks it can implement lockdowns, curfews, draconian measures for a virus which, by all accounts, has a 99-point-something% survival rate. And the people who are at risk are indeed at risk. And a policy that punishes everybody without actually protecting those who are at risk is a failed policy. And to sit there and commemorate the results of failed policy is itself additional failure. And at this point, I'm not surprised to see anything else from the government. Okay. No happy ending to this discussion. This is failure compounded by failure, and the consequences of this failure we're going to be experiencing for a generation at the very least, in my humble opinion, which is worth what it is. All right, people. See you later.